Today, it's the disease you fear most, cancer. But it doesn't have to be that way. Diagnosis is often made too late because the warning signs of the disease mimic other conditions. So today, I'm giving you the power to detect the 4 cancer symptoms women are most likely to ignore. So let's get right to the detective work. The first symptom is bruising, because bruising can be a symptom of leukemia. Bruising is a symptom you just might ignore because you think you're just getting older. You're a klutz. You might be anemic. They're minor side effects from your medications. But bruising on the body could actually be a symptom of leukemia because this cancer is a disease of the blood that can slow down the production of platelets, which help clot your blood. With fewer platelets, your blood's ability to clot diminishes drastically, giving way to easy bruising. So how do you know if your bruising is normal or if it's a sign of leukemia? Maria's here to find out. You get bruised often, I hear.
I do. I have a 2- and a 4-year-old, and they think I'm a jungle gym, so my legs are pretty much all bruised up.
Up and down.
Up and down.
All right. So the issue of bruising, of course, is an important one because we all get it from different reasons. When you get your bruises, how long do they last?
Probably about a week.
Right. Which is a pretty normal term. So let's go over when to worry. When are bruises concerning to a doctor? First issue, fevers and chills. Does that ever happen to you?
Not really, only when I'm sick, which is not often.
All right, second big quick clue is whether people have persistent fatigue. Have you experienced that?
Well, I have the normal fatigue of a mother.
Kids.
Yes.
It's a harder question to answer. The kind of fatigue you have with leukemia, really, you just can't get out of bed. It's not related to a tough day at all. And the last symptom is often bone pain. As the bone cancer is growing inside the bone, it will really stretch it, and you'll feel the aching in there. Does it happen to you?
No, I feel great.
Well, I think you're good to go. I'm happy for that.
Thank
for
you.
All right.
Thanks.
So if you answered no to all of these, then fine. The bruising is normal. But for anyone who had bruising coupled with any of these symptoms, I don't want you to ignore it. We can cure these problems if we know about them in time. The next cancer symptom that many people ignore, women in particular, is indigestion. Because indigestion can be a symptom of esophageal cancer. Indigestion. It's the symptom you ignore because you think it's caused by something you ate. Yesterday's late night binge. Cheating on your diet. You're busy and always eating on the go. But indigestion could also be a symptom of esophageal cancer when it's caused by chronic heartburn or acid reflux. That's when the contents of your stomach back up into your esophagus, irritating the lining and over time, creating abnormal cells that morph into cancer. So, when is indigestion a sign of esophageal cancer? Michelle, like most women, has had some indigestion. She's here to find out. So I just showed you a little video explaining why I'm concerned about indigestion. If I can, I'm gonna actually show you a real stomach and esophagus. Oh. One normal, one not so normal. So I just want to point out that as you have a normal esophagus here, moving into the stomach, there's a very smooth transition. Go ahead and feel that. And compare that to this not so smooth. Look at how the esophagus shrunk here.
Yeah.
You see, it doesn't have these nice little lines anymore.
Right.
It's all scarred in. That makes it shorten, but also pulls it together. And feel right here, that thick stuff, that's an early cancer.
Ooh. Wow.
We're seeing a lot more of this problem because of that acid issue. So how long does it last when you get it? Because that's a big clue.
Sometimes overnight. It depends.
Does it last for a couple days?
No. I'm usually going by the next day. It's usually over by the next day.
That's a good sign. You ever get sore throats that last a long time?
No.
That's an important sign because the acid can go up and burn your vocal cords.
Oh, okay. Didn't know that.
So again, anyone who has indigestion, who's coupled with the other symptoms I just gave you to worry about, they're not going to ignore that. Again, a treatable problem if we find it.
Okay, great. Thanks for telling me.
Let's get to another symptom that you're likely to ignore, and I want you to detect this one. It's night sweats. And the reason I'm concerned about night sweats is they can be a symptom of lymphoma. Night sweats are a symptom easy to ignore because your hormones go haywire at least once a month. It's just a hot flash. The bed's too warm. You're fighting a fever. But night sweats could also mean lymphoma, a cancer of your lymphatic system. That's because the progression of lymphoma and the way your body fights infections are similar, mobilizing immune cells, causing fever, achy muscles, and night sweats. So when are those night sweats a sign of cancer? Jan's here to find out. She says she sometimes has occasional night sweats. So describe them for me. How often do you have them?
I'm over 40, so maybe once a week, often during the month.
Right.
4 times, 5 times a month.
So lymphomas can cause problems in many different ways, but let me, if I can, explain what's going on inside your body when you have that diagnosis.
Yes.
This is a normal spleen. And you see how it's elegant, sort of thin? This is about the size of your cell phone. That's how you can think about your spleen. It's way up here in the upper left side of your belly. Right?
Okay.
However, when it's infiltrated by a tumor, it looks
Wow.
like that. So you can take your gloves off, because I'm going to teach you when you should worry about night sweats. Because you're right, they do happen a lot when we get past age 40, and they last a long
Yes.
time sometimes. So the first clue we always look for, if you were to tell your doctor you have night sweats, is whether or not you have swollen lymph nodes. You know how to examine for those?
No.
You all want to do this with me? If we get on. So everyone sits strong in the chair. I'm going to take 3 fingers and then very lightly press behind your ears. Just gently press behind your ears. You shouldn't feel anything abnormal there, but you do have lymph nodes. So you start there and then work your way down on each side of your neck like this, down to the jawline, and then work it around the jawline here, and then gently move down from the jawline along these muscles to your collarbone right here. Now, if you feel a small, really flexible, movable lump,
Okay.
the size of a kidney bean or so, I don't worry about that. You know, when you're a kid, you get those really swollen nodes.
Yes.
You know, if they're tender, by the way, that's a good sign. Tender lymph nodes means infection. If it's a painless lymph node and it's bigger than that little kidney bean and the areas I just showed you, that makes me concerned, especially if you can't move it that readily, because tumors will grow and they'll sort of stick to the tissues around them.
Okay.
That's one of the first big things. I don't see anything visually. Do you have anything?
No.
You felt pretty healthy?
I do.
Yeah, you look good. Your thyroid's sort of prominent, by the way.
Is
Did
it?
you notice?
I have noticed that
Yeah,
recently.
so a little fullness in there, just a little hint since you're on the show. All right.
Thank you.
Yeah. Forget about that for now. We're talking about more important things like lymphomas. How about problems with breathing? Any difficulty with that?
No, not at all.
All right,
No.
that's another issue I worry about because that will often go along with lymphomas. And finally, unexplained weight loss. I know you all want to lose weight.
Yes.
But when you lose weight, when you're not trying to lose weight, that's what I'm speaking about.
No weight loss.
No weight loss. Darn it. All right. So if you get night sweats plus any of those symptoms, that's when you have to worry. Thanks very much.
Oh, good.
All right.
Thank you.
Now let's get to one more symptom that I don't want you to ignore. It's bleeding in between your periods. Remember, bleeding between your periods is a concern for a lot of reasons, but it can especially be an issue if you have uterine cancer.
Bleeding between periods is a symptom women ignore because you're stressed out, you're on the pill. It's just another sign of menopause. You've got fibroids and you think they're probably harmless. But irregular bleeding could be a symptom of uterine cancer. In fact, it's actually the most common symptom because the cancerous lining of the uterus constantly continues to grow and shed, causing the abnormal bleeding.
So let's look at a uterus and what happens when you get a cancer there. Normally, it's pretty small size. It's like 2 golf balls attached to each other, basically, with these little ovaries next to it. But that's the uterus there. Let me show you what happens if you have a uterine tumor. It turns to that. Now look at the size difference here. You know, very small, sort of dainty-looking structure becomes massively enlarged, and it becomes thick and so big you think, how could I imagine not knowing this is there? But you'll miss the diagnosis sometimes because there's a lot of space in your belly. You'll think you put a little weight on. So the question is, when should you worry about breakthrough bleeding? You worry about it when it's coupled with bloating. You worry about if it's causing pain during urination or during sex. And you worry about it if you've got pelvic pain. Those are the big clues. Do not ignore those symptoms. Listen, all of these are issues you can control. I know we don't want to sometimes know if you've got problems, but I picked specifically problems that you can address aggressively, and we can help you with as doctors if you tell us. If you're worried about any symptoms at all, you can download the Ask MD app on DrOz.com. It can help you know when to worry and when not to. All you got to do is answer a few quick questions.
Thank you for watching. Don't forget to subscribe and turn on notifications so you never miss out on new videos to live the good life.